If you're over 60, the first 30 seconds after you wake up may matter more for your heart than almost anything else you do all day. There's a small mistake, one most of us were never taught to avoid, that puts extra strain on your cardiovascular system right when it's already at its most vulnerable. By the end of this video, you'll know exactly what that mistake is, why mornings are different for your heart, and the simple fix that doctors commonly recommend. In the next few minutes, I'm going to walk you through why the morning hours carry unique cardiovascular risk, what's actually happening inside your body in those first moments after waking, and the one small habit change that's often suggested, especially if you manage blood pressure issues. This isn't about fear. It's about giving you a tool you can use starting tomorrow morning. Quick note before we dive in. This channel is for general health education. I'm not your doctor, and nothing here replaces the advice of your physician, who knows your specific health history. Think of this as information to bring to your doctor, a way to ask better questions, not to second-guess the relationship you already have with your care team. Let's start with something many people don't realize. Your cardiovascular system doesn't behave the same way at 7 in the morning as it does at 2 in the afternoon. Researchers have long observed what's sometimes called a morning surge in cardiovascular activity. Heart-related events tend to cluster more heavily in the first few hours after waking compared with other times of day. Here's the plain English version of why that happens. While you sleep, your body is calm, heart rate is low, and blood pressure dips. But in the hour or so before and after waking, your body releases a wave of hormones, including cortisol and adrenaline, to help switch on your systems for the day. This causes a natural rise in blood pressure, an increase in heart rate, and a temporary increase in how easily your blood clots, which is actually useful for healing wounds, but can be a factor for people who already have narrowed arteries. So your body is already doing a lot of work in those first minutes. That's just biology. It happens to everyone. But the next part is where the mistake comes in, and it surprised me when I first learned about it. Coming up, I'll show you the exact mistake, and it's something almost all of us do without thinking. But first, let's talk about who this matters most for, because the risk isn't equal for everyone. If you're managing high blood pressure, have a history of heart disease, diabetes, or you've been told you have orthostatic hypotension, that's a sudden drop in blood pressure when you stand up. This next part is especially relevant to you. Orthostatic hypotension becomes more common as we age. It happens because the body's reflexes for adjusting blood pressure when we change position can become a little slower to respond over time. Here's the everyday version. Gravity pulls blood down toward your legs the moment you sit or stand up. In a younger body, blood vessels and the nervous system compensate almost instantly. In an older body, that compensation can lag, even just slightly, which is why some people feel dizzy, lightheaded, or briefly foggy when they stand too fast. Now combine that with the morning surge we just talked about, blood pressure already shifting, heart rate already adjusting, and you can see why doctors pay special attention to those first moments out of bed. So here's the mistake, and I promise it's simpler than you think. It's jumping straight from lying down to standing up, all in one motion. The alarm goes off, you swing your legs out, and you're upright in 2 seconds. For most of your life, that was no problem. But after 60, especially if blood pressure or heart health is already something you manage, that abrupt change asks your cardiovascular system to do 3 things at once, instantly. It has to pump blood upward against gravity, adjust to the hormonal surge already happening, and stabilize blood pressure fast enough to keep blood flowing properly to your brain. When all of that happens too quickly, it can lead to dizziness, lightheadedness, a fall, and for some people with underlying cardiovascular conditions, added strain during an already higher risk window. To be clear, this doesn't mean standing up fast simply causes a heart attack in a direct, one-to-one way. That would be an oversimplification, and I want to be honest with you about that. What's well understood is that combining a sudden postural change with the body's natural morning cardiovascular shifts is an unnecessary added stressor, and it's one of the easiest things to remove from your routine. This is the part I promised you at the start, the fix, and it's almost embarrassingly simple, which is probably why it doesn't get talked about enough. It's sometimes called the 3-step rise, and it's commonly recommended for people managing blood pressure concerns or orthostatic hypotension. When you wake up, stay lying down for about 10 to 15 seconds. Wiggle your fingers and toes. Let your body register that it's awake before it has to do anything else. Then slowly sit up and dangle your legs over the side of the bed for another 10 to 15 seconds. This gives your blood pressure regulation system time to catch up with gravity. Finally, stand up slowly and pause for a moment before you start walking. If you feel any dizziness at all, sit back down immediately. That's it. 3 simple steps, roughly 30 seconds total, the same 30 seconds we talked about earlier, just used differently. It costs you nothing. It doesn't require buying anything or changing your medication. It's simply a pause, a small buffer between asleep and in motion. A few related things are worth keeping in mind as well. Hydration matters. Many people are mildly dehydrated by morning after hours without water, and dehydration can affect blood pressure regulation. So, a glass of water once you're up and steady is a simple, safe habit. If you exercise in the morning, give yourself a short warm up period before anything intense so your cardiovascular system has time to adjust. And if you check blood pressure at home, taking your reading a few minutes after you're up, rather than the moment you get out of bed, gives your doctor a more consistent and useful picture over time. None of these are dramatic changes. They're small adjustments that work with your body's natural rhythm instead of against it. So let's close the loop we opened earlier. The 30-second mistake is rushing from lying down to standing up in one motion during the exact window when your cardiovascular system is already adjusting to the morning's natural hormonal and blood pressure shifts. The fix isn't medication, and it isn't a supplement. It's simply slowing down that transition using the 3-step approach we just covered. Here's what I'd suggest trying starting tomorrow. Practice the 3-step rise, lying still, then sitting up, then standing, pausing for 10 to 15 seconds at each stage. Keep a glass of water by your bed and drink it once you're up and steady. If you regularly feel dizzy or lightheaded in the morning, write down when it happens and bring that information to your next doctor's visit, because it's genuinely useful detail for them to have. And most importantly, never stop or change a blood pressure or heart medication based on something you watched online. Always talk to your doctor first about anything new, including this habit, especially if you have an existing heart or blood pressure condition. You don't need to overhaul your whole morning to take care of your heart. Sometimes it really is the small, quiet habits that matter most. If this helped you understand your mornings a little better, hit subscribe so you don't miss the next video, where we'll talk about the surprising connection between sleep position and blood pressure, something almost nobody asks their doctor about but probably should. Take care of yourself, and I'll see you in the next one.